Hey there, welcome to my YouTube channel. Really appreciate you being here. So, I had an interesting encounter, I think it was on Wednesday. So, Wednesday night, my girlfriend went out for date night and shot some guns. I burned myself nice and good. Yay! Brass casings. But then later on, we went out for dinner and met this really cool guy. He was a server. Well, he was our server. And I usually just like chat with people, see how they're doing, get to know them. And then in this particular instance, he really just opened up. He was talking about how he was struggling with some issues, some addiction problems and some marriage problems, things like that, custody with his kids, that type of stuff. And it ended up being a really sad story. I mean, the evening itself ended up being really good. Like, he thanked us for chatting with him, and it felt like it really got a lot off his chest. We sat down, prayed with him, and at the end, he was like crying, like happy tears is what he said. And then we had a big hug and left him a big tip. But yeah, it was interesting because a part of the conversation shifted towards just how he's been trying to get help. And how it's so difficult for him to get help. My girlfriend was with a mental health care facility as a social worker here in Indianapolis, and her experience was really rough, like really rough. So essentially, the people that work there, it's all passion. So they are severely overworked and severely underpaid, and I mean, the clear and obvious solution is increase funding, but finding where the funding would come from, I guess, would be kind of an upfront tricky obstacle. But when this guy was sharing his story, it was just heartbreaking because he was trying to do all the steps, trying to do everything he could to like turn himself around, be better, do better, get better. And everything he was trying just wasn't, like, it was working mostly, but because he had such long intervals in between his caretakers and the drugs that he was given, he wasn't given enough drugs to continue through the whole thing. Yeah, Bill, thank you. Who managed the funding is also important. Absolutely. And that's kind of one of the things I wanted to get into. So, but anyway, so his story was that he was taking prescription medication to help him come clean from his addictions, but also to like help some of his behaviors. But he said that he wasn't getting enough medication to survive the entire time. VA is a perfect example of more money doesn't always fix the problems. Yeah. That's a whole other story. Actually, that might almost be worth bringing up. So there's another YouTuber, his name's Angry Cops. He's usually really funny. He jokes a lot about the military. But there's one particular video he did somewhat recently where he dang near broke down and cried on camera. Because in Canada, they were basically telling people vets that were calling in asking for help. He was basically telling this call receptionist was like, yeah, maybe it'd be better if you just, like end yourself. That would probably be better for you. And then this vet called in and just like losing it on the guy. Like, what are you talking about? Like, no, I just want to get better. Why are you giving me this advice? And the call taker was like, well, I helped another veteran end himself. We even got counseling for his wife and his kids after the process was over. So Angry Cops is trying to do this video, and he just like, he's usually funny. He's a drill sergeant, so he's doing like all his drill sergeant-y stuff and trying to be over the top. But this time he was like, it was not good. He had to walk off camera and put up a suicide hotline number and all this kind of stuff. So anyway, yeah, VA bill is a great example of more money doesn't exactly fix the problem. So I think better oversight would probably be a better answer. But I mean, better oversight would definitely help, like in the server situation, because he was getting this medication that was supposed to be helping him. And not only was it was actually helping, but because he had to go, I forget, it was like 6 days without, because it's a prescription you have to take every day. And if you don't take it every day, then you start to go through withdrawal. And he said that withdrawal from this drug was worse than heroin withdrawal. And heroin withdrawal can literally kill you, according to a personal friend of mine who is an actual doctor. So alcohol withdrawal can kill you, and heroin withdrawal can kill you. The rest, you'll just feel like you want to die. But anyway, so if there had been proper oversight, as you pointed out, Bill, then there would have been a much better chance that, like, hey, let's make sure this guy has enough medication to continue to take it daily without having to go so far in between prescriptions. And the other thing was he has to visit I think it's a psychologist. It's a psychologist or psychiatrist. One is Brainy Bits with words. The other is Brainy Bits with medicine. He needs to see the Brainy Bits with medicine person, whoever that one was. But anyway, he had to wait a month to go in because like the person's just unavailable. And my girlfriend's experience is that these mental health care workers are just so unbelievably overworked and underpaid. I mean, they're just seeing people constantly, and it's after you do it, if you care enough about the patients to want to see them get better, you'll get emotionally burned out. Either you'll get emotionally burned out from the job and just kind of do stuff and not really give adequate care, or you'll get burned out from the job and leave, which is kind of what happens with a lot of these people. So her facility, I think they lost like half their people in a pretty short time frame. There are requirements from the oversight organization that makes individuals jump through a lot of hoops. Oh, yeah. So the hiring process is, thank you, Candace. So the hiring process is a lot more difficult. So this is not something I'm super well versed with. I was hoping some people in the chat might be able to help me out with this one because I don't fully understand the full scope. Sorry, I lost train of thought. I got a text message. I should probably turn this off or something. Everybody keeps wanting to text me right now of all times. Like, come on, got a live stream every Monday and Thursday at 6. Don't text me at that time, and that's when everybody wants to text. Anyway, so the so the mental health care system is something I'm less familiar with, but everything you hear about it, it's just ridiculous to try to make things work. Another example. So during quarantine, regardless of how you feel about it, Governor Holcomb, governor of Indiana, said that you cannot do testings for getting license renewed and whatnot. So whatever your license is, if you have to take a test to qualify for it, that's, you can't take tests because we're in quarantine. Regardless of how I feel about it, it's like, okay, sure, that at least in that moment, that makes sense. So no qualms there. But what he also did was said, if you have a temporary license, we're going to go ahead and let that expire. So if anybody was working on a temporary license that needed to take a test, they can't take the test. And everybody who had a temporary license that needed to be licensed to work, they all got fired. So, like, why is that a good idea? So anyway, just stupid things like that, which, by the way, I have a very deep personal gripe against Governor Holcomb. I've actually considered running for Indiana governor, possibly in 24. I don't know. That's something I'm kind of kicking around right now because I have such a deep spite against him. That and everybody that I know that knows him or has dealt with him, like, hates the guy. So, yeah. And they're like, most of these people are right-leaning, and Holcomb's supposed to be Republican. So, yeah, they're just like, yeah, he's just kind of a garbage human being. He doesn't really get stuff done. He makes stupid choices. He tries to get people arrested when they cannot be arrested, so he doesn't know the law that well either, apparently. So anyway, yeah, just all the reasons why I should probably run for governor. So apparently people like it when you hold a public office before you run for POTUS. So shocker, I know, but yeah, so it's one of those things. Anyway, back to mental health care. So what I was thinking, as far as the 3 acts go, I think this is something that the ACB would probably handle well. The combination between the Titus Act and the ACB, if you're not familiar, if you're new to the channel, the Titus Act is basically decentralization of the federal government and puts the federal funding and the federal budget into state governments. Then the state governments can have a more direct control over what they do. The ACB is basically anti-corruption. The Anti-Corruption Bureau will oversee basically all these statewide entities. So basically people that used to work for the IRS, because, you know, if they're going to downsize federal government, some people will probably end up losing their job. Those people, instead of just straight up losing their job, they could, instead of auditing private individuals, private citizens, they will instead audit corporations and companies, or not corporations, and in some cases that would be true, but specifically politicians, local politicians, state politicians. So something like that, that would help to make sure, like, okay, is oversight for this funding going to the correct places? Are we doing the necessary things? Are the people getting the help that they need? Are we doing this correctly? And I think people like the server that we met with, people who try to go to the VA for help, individuals like this will get better help. They will be able to get the attention that they need. And I think it will be a better way to move forward. So I would really like to hear your thoughts on this. This is something I'm really not strong in. I don't know a whole lot about this. The only thing I know is universally, like, it's pretty bad. And anybody that works in the field can say it's pretty bad. And anybody that's tried to get help, all universally say it's pretty bad. So I don't know of a great solution other than they just kind of need an overhaul. There needs to be more than just awareness. I mean, awareness definitely helps. There definitely needs to be an awareness, because I think a lot of people are totally oblivious to it. And this would be a direct thing that would definitely directly help a lot of individuals, especially those in our society that are suffering the most. So anyway, I think that'd be good. I feel like a solution and an answer and a fix is absolutely possible. I would really like to see some kind of change, or see suggestions and more specific thoughts. So if you have a thought or an idea about this, or have experience with it, please, my goodness, leave a comment below. I would really like to hear your thoughts. Also, if you like this video or just this kind of topics, please give the video a like. Insurance is needed to change, Candace. Yes, absolutely. That is a whole other tangent. I think insurance is the, I would say, biggest scam in America. College would be the second biggest scam in America. But yeah, so the whole insurance thing, even my very limited experience with the medical field, oh man, insurance is clearly not the answer. That needs a massive overhaul. And they are the holders of, insurance is holders of the care. Oh, okay. I didn't fully realize that. So yeah, insurance needs to have a bit less power, I would think, just off the cuff. Just, you know, my little small brain bean bits trying to rub some sparks together says that. So I don't really know the full scope of it, but yeah, I could see that being like a big step forward. So doing overhaul of the insurance, which I have a couple ideas for that. Maybe I'll do a different video on that. My ideas for how I think we should probably fix insurance moving forward. I have some friends that work in the insurance industry, and they would probably not like that video, at least my ideas. But anyway, Bill, I can give my insight on VA as a patient and a former employee. Oh, both as rank and file and as management. Hey, Bill, that would be great. Shoot, I would like to do a second video. You know what? I'll do a follow-up video on this one about the VA. Bill, if you don't mind videoing in sometime as like a guest, that would be great. And I could just like pick your brain. You can tell me what you think, tell me your experiences. And hey, maybe we can come up with like an actual, instead of just griping about it, have like an actual like forward-moving positive. Like, you were doing this, like, if this were different, this would make this better. This would improve this process. And I'll do my best with my very limited knowledge to be like devil's advocate, like, well, if you do this, then what about this as a consequence? How will this be impacted? So anyway, that would be great. If you're open to it, I can get a hold of you. So anyway, yeah, so as far as this video is concerned, please leave a comment below. I really, really want to hear your thoughts on it. So, but that's all I've got for now. Oh, dang, this video's already gone on 14 minutes. So yeah, that's all I got for now. Thank you so much for tuning in, and as always, stay classy. And I did that in awkward timing because it took way too long. So anyway.